Here we go. Welcome, one and all. I'm here to talk to you about breast cancer. It's funny you should see a guy up here talking to you about breast cancer. This type of cancer affects women. But what about the guys? It also affects us as well. How is that, you might ask? Well, we all have a mother, a grandmother, aunt, sister, cousin, wife, or friend who's been hit by this illness. What is breast cancer? Simply put, it's an uncontrolled growth of breast cells. Cancer occurs as a result of mutations or abnormal changes in the genes responsible for regulating the growth of cells, keeping them healthy. It begins as a malignant tumor. Over time, the tumor will begin to grow wildly and begin to move throughout the body. If the tumor gains access to our lymph nodes, it has access to vital areas and organs of your body. Hence, breast cancer can kill you. What are the treatment types for breast cancer? Well, there's always surgery. An invasive surgery to remove the breast cancer doesn't always mean the cancer's gone for good. Surgery is usually the first way to attempt to get rid of the cancer. A surgeon will discuss options with you. A specific surgical procedure may be recommended for you based on the size, location, the type of breast cancer you have. In some cases, therapy is needed afterwards. Radiation therapy or chemotherapy may be required to ensure the cancer cells are gone or dormant. Therapy itself is a painless procedure. Its side effects range from dizziness, nausea, fatigue, skin discoloration, and at times, hair loss. Luckily, side effects are only temporary. Radiation therapy can decrease the risk of cancer returning to the patient. What can we do to lower the risk of breast cancer? Let's begin with your nutrition. Give your body the proper nutrients it needs to maintain a balanced diet. A proper workout regimen is also what the doctor ordered. A healthy weight plus a balanced diet will help lower the risks of breast cancer. Another thing that women can do is check your breasts. Sorry guys, we can't volunteer for this job. Women, please check your breasts regularly and feel for an abnormal growth. Keep in mind, our bodies are a wonderful piece of machinery. There's just enough space for everything that we're supposed to have in it. If there's a growth ongoing, you know it. Please consult your physician immediately. Early detection is vital for survival. Get a mammogram done. Right now, a mammogram is the most effective technique around to help reduce the fatality rate of this form of cancer. According to the National Cancer Institute, women in their 40s and older should have a mammogram done every 1 to 2 years. How can we help the cause? National Breast Cancer Awareness Month has been celebrating 25 years of awareness and education. This past weekend, I went to Bayfront Park in Miami to volunteer my time to do the walk. To hear the survivors of breast cancer speak about their ordeals and how they cope with their situations moved me. It's hard to imagine a 45-mile walk could affect me in such a way. This one did. To see a huge group of people gathered to walk, to fight for a cause we so deeply believe in. I had to open my mind and try to understand the whole picture. My sister-in-law had a battle with breast cancer. To see how it affected her siblings, her parents, my wife, I was astounded. We all should join together. My family and I, we joined my sister-in-law Edith on her walk for breast cancer. Just in our group alone, we were 40 strong. We gathered to say there were tens of thousands of people joined in this fight. On this day, there are no blacks, no whites, no Asians, no Hispanics. We are as one. One, united to fight the worthy cause. When someone's world is turned upside down by a breast cancer diagnosis, the Breast Cancer Network of Strength is there, 24 hours a day, 7 days a week, 365 days a year. The Network of Strength is here today to ensure, through information, empowerment, and peer support, that no one faces breast cancer alone. In short, please give, whether it's time, money, or resources, they need our help. Breast cancer, again, just doesn't affect women. It affects all of us. After you give, that warm feeling you'll have inside is called satisfaction. Satisfaction in the sense that you joined the fight, and we can hope one day not only to win the battle, but win the war. Thank you.